Ladies and gentlemen, focus is not a fixed trait. It's a trainable ability deeply tied to the brain's capacity for neuroplasticity. Neuroplasticity refers to the brain's ability to change its structure and function in response to experience. This includes how neurons communicate with each other, the strength of those connections, and even the growth of new neural pathways. When we talk about training focus like a muscle, we're really referring to this underlying biological mechanism. Just as physical muscles grow stronger through consistent stress and recovery cycles, attentional systems in the brain adapt and strengthen when subjected to focused effort followed by rest. The prefrontal cortex is the primary region involved in deliberate focus. It acts as a sort of conductor for goal-directed behavior, suppressing irrelevant stimuli and allowing the brain to stay on task. However, this system is not always automatically engaged. In a distracted world with constant notifications, multitasking, and fragmented attention, the prefrontal cortex is often overridden by more reactive parts of the brain like the limbic system. Over time, this leads to poor attentional control, making it difficult for many people to engage in deep work or sustain concentration. The good news is that this pattern can be reversed. Training focus through intentional practices initiates a cascade of biological changes. When we repeatedly engage in deep concentration, we stimulate the release of neuromodulators, especially acetylcholine and dopamine, that signal to the brain that something important is happening. Acetylcholine helps increase the signal-to-noise ratio in neural circuits, essentially sharpening the brain's ability to highlight relevant information and suppress distractions. Dopamine, often misunderstood as simply a pleasure chemical, is also a marker of salience and motivational drive. When dopamine is released during focused work, it reinforces those neural pathways and makes it more likely that the brain will return to those same patterns in the future. This is where the concept of reps comes into play. Just as someone lifts weights in sets and repetitions to grow muscle, short intervals of focused work followed by deliberate rest build the neural circuitry for sustained attention. At the cellular level, this training leads to long-term potentiation, LTP, a mechanism that strengthens the synapses between neurons. LTP is a foundational process for learning and memory and is particularly relevant when talking about improving focus. The more frequently a neural circuit is activated, like the one responsible for filtering distractions, the more efficient and dominant it becomes over time. Environmental factors also shape neuroplasticity. For example, if someone always studies in a noisy, chaotic space, the brain adapts to that input and focus becomes contingent on that background noise. Conversely, when you set up a consistent, low distraction environment, the brain begins to associate that space with concentrated effort. Over time, this environmental cue becomes a trigger for deeper focus, a process known as context-dependent learning. This further reinforces the neural circuits related to attentional control. Sleep, nutrition, and physical activity also play critical roles in supporting neuroplasticity. Deep sleep, particularly slow wave and REM sleep, allows the brain to consolidate the neural changes that occurred during the day. Sleep deprivation, on the other hand, impairs the function of the prefrontal cortex and diminishes the brain's ability to form new connections. Omega-3 fatty acids, certain amino acids like tyrosine, and micronutrients and magnesium and zinc all support the structural components of neuroplasticity. Meanwhile, aerobic exercise increases levels of brain-derived neurotrophic factor, BENF, a protein that acts like fertilizer for neurons, promoting growth and resilience in attentional circuits. There's also a critical emotional component. When someone believes that they can improve their focus through effort, a mindset rooted in growth rather than fixed capacity, they are more likely to engage in the kinds of behaviors that promote neuroplasticity. This is not just psychological. Belief and motivation influence the neurochemical environment of the brain, particularly through the dopamine system. High levels of motivation enhance learning by tagging experiences as meaningful, increasing the probability that those experiences will lead to durable neural change. Over weeks and months of repeated practice, the brain literally begins to rewire itself for focus. This includes greater activation and structural integrity of the prefrontal cortex, enhanced communication between attentional networks, and improved regulation of competing systems like the default mode network, which is responsible for mind wandering and internal chatter. The default mode network, or DM, is a specific set of interconnected brain regions that becomes active when a person is not focused on the outside world and instead turns attention inward. This network includes structures such as the medial prefrontal cortex, posterior cingulate cortex, precuneus, and parts of the inferior parietal lobule. The DIM is most active during wakeful rest, daydreaming, mind wandering, or when recalling the past and imagining the future. While this internal mode of cognition plays an essential role in creativity, self-reflection, and problem solving, it can also interfere with focused tasks when it's activated inappropriately or excessively. From a neurological perspective, the DIM is essentially the brain's idle or default state. When you're not directing your attention toward a specific external task, your brain doesn't go silent. It switches to this inward-directed mode. One could think of it as the brain's background processing system. This includes autobiographical memory, thinking about others' perspectives, and constructing hypothetical scenarios, functions that are valuable for complex human cognition. However, in the context of training focus like a muscle, the DIM represents a kind of resistance to overcome. It's the voice that pulls attention away from a task, leading to distractions, intrusive thoughts, or a loss of mental engagement. What's particularly important to understand is that the DIM and task-positive networks, those responsible for focus and attention, operate in a kind of push-pull dynamic. When the DIM is highly active, task-focused networks such as the dorsal attention network, DAN, tend to be suppressed. Conversely, when someone is deeply engaged in a cognitively demanding task, activity in the diminishes. In other words, there is a neurobiological trade-off between being focused and being inwardly reflective. This reciprocal relationship is not accidental, but rather a reflection of how limited attentional resources are distributed in the brain. You can't be fully focused on an external task and simultaneously engage in deep self-reflection or mind wandering. They draw from overlapping resources. The challenge in focus training lies in learning how to suppress or quiet the DIM during periods when external attention is required. This doesn't mean trying to eliminate the DIM altogether. Rather, it's about learning to control when it activates. In people who struggle with focus, such as those with ADHD or high levels of stress, the DIM often becomes active even during tasks that should require full attention. This results in fragmented cognition, lapses in concentration, and a general sense of mental fatigue. Functional MRI studies have shown that people who are able to sustain attention for longer periods show lower DIM activity during cognitive tasks compared to those who are more easily distracted. There are specific strategies and biological mechanisms that help regulate DIM activity. One is meditation and breath work, particularly focused attention meditation. These practices train the brain to notice when the mind wanders and gently redirect attention to a specific anchor like the breath or bodily sensations. Repeating this redirection over time changes brain activity patterns, leading to decreased NIM activation during focused tasks and increased engagement of the attentional control networks. Electroencephalogram, EEG, and fMRI studies consistently show that regular meditation practice is associated with changes in NIM connectivity and reduced spontaneous activity in its core regions. Another key modulator is the neurotransmitter norepinephrine, which is released from the locus coeruleus during alert states. When norepinephrine levels are appropriately elevated, the brain enters a more externally focused, high-signal, low-noise mode of operation. This helps suppress brain to notice when the mind wanders and gently redirect attention to a specific anchor like the breath or bodily sensations. Repeating this redirection over time changes brain activity patterns, leading to decreased NIM activation during focused tasks and increased engagement of the attentional control networks. Electroencephalogram, EEG, and fMRI studies consistently show that regular meditation practice is associated with changes in NIM connectivity and reduced spontaneous activity in its core regions. Another key modulator is the neurotransmitter norepinephrine, which is released from the locus coeruleus during alert states. When norepinephrine levels are appropriately elevated, the brain enters a more externally focused, high-signal, low-noise mode of operation. This helps suppress MEN activity and enhance processing in task-relevant regions. Interestingly, when norepinephrine is either too low, as in fatigue or boredom, or too high, as in stress or anxiety, the balance shifts and NIM malleability can reemerge, disrupting focus. Visual attention techniques also help inhibit the DIM. Fixating on a specific visual point in the environment or narrowing the field of view can decrease NIM activity. This is due to the close connection between the visual system and the attentional networks in the brain. Vision is not just about seeing, it's tightly linked to cognition. When you lock your gaze, you signal to the brain that something requires focused attention, and the brain responds by dampening internally oriented processes. Sleep and recovery also play a role in regulating DIM activity. Chronic sleep deprivation is associated with increased spontaneous NIM activation, which correlates with mind wandering. Poor decision-making and emotional instability. When sleep is optimized, particularly deep, slow wave and REM phases, then undergoes a kind of recalibration, allowing for better regulation during waking hours. Similarly, acute bouts of physical exercise, particularly aerobic movement, have been shown to transiently reduce DIM activity, likely due to shifts in blood flow, neurotransmitter release, and increased engagement of motor planning networks. The dynamic nature of the DIM is also evident in its involvement with mental health conditions. Elevated DIM activity, particularly in the medial prefrontal cortex, is a common feature in depression, anxiety, and rumination. These states involve persistent internal dialogue and negative self-referential thoughts, essentially the DIM running in overdrive. This underscores the importance of learning to modulate this network, not just for focus, but also for emotional resilience. Dopamine is a neuromodulator that plays a central role in regulating attention, motivation, and goal-directed behavior. While it is often popularly associated with pleasure or reward, its true biological function is more nuanced. Dopamine is fundamentally about salience. It helps the brain determine what is important and worth paying attention to. When it comes to sustained attention, dopamine acts as a kind of amplifier that enhances signal strength in specific neural circuits, helping to stabilize focus and reinforce behaviors that are perceived as valuable or relevant to one's goals. The dopaminergic system originates in several key regions of the brain, most notably the ventral tegmental area, VDA, and the substantia nigra. These areas send dopaminergic projections to other parts of the brain, including the prefrontal cortex, which is critical for executive function. Internal or external interruptions. On the other hand, D2 receptors are more associated with flexibility and switching between tasks or mental states. An appropriate balance between these receptor pathways allows for both sustained attention and adaptive responses to changing environments. One of the key features of dopamine's involvement in attention is its role in anticipation. Dopamine release doesn't just occur when a reward is received. It often spikes when a cue signals that a reward is likely. This anticipatory dopamine release helps to energize the brain toward action. In cognitive terms, it means that dopamine helps sustain attention by attaching value to the outcome of the task at hand. When a person is working toward a goal, even if the reward is distant or abstract, dopamine helps maintain a forward-directed sense of drive. Without this signal, the brain becomes less motivated to continue the task and attention drifts. From a functional standpoint, dopamine enhances the contrast between relevant and irrelevant information in the brain. It sharpens the signal-to-noise ratio, particularly in circuits involving the prefrontal cortex and striatum. This selective enhancement allows the brain to zero in on task-relevant stimuli while minimizing interference from competing inputs. The result is a more stable, coherent, attentional field. Over time, repeated engagement in focused activity that is accompanied by dopamine release strengthens the neural pathways involved, reinforcing the capacity for sustained attention in future tasks. This is one of the primary mechanisms by which attentional skills can be trained through deliberate practice. Behavioral and environmental factors can influence dopamine levels in real time. Novelty, for example, is a natural driver of dopamine. When a task feels new or presents a slight challenge, the brain interprets this as an opportunity for reward and releases dopamine accordingly. This is why attention is often easier to maintain at the beginning of a task or when encountering something unfamiliar. As the task becomes routine or repetitive, dopamine release tends to decline, leading to reduced focus unless strategies are implemented to reintroduce novelty or vary the context. Sleep, nutrition, and physical exercise all play essential roles in regulating baseline dopamine tone and receptor sensitivity. Sleep deprivation is known to blunt dopamine receptor responsiveness, particularly in the prefrontal cortex, leading to impaired attention, increased distractibility, and diminished task engagement. Physical exercise, especially aerobic activity, has been shown to increase dopamine synthesis and receptor availability, particularly in regions associated with cognitive control. Nutritionally, amino acids such as tyrosine and phenylalanine are precursors to dopamine synthesis. A deficiency in these nutrients can result in reduced dopamine production, thereby compromising attention and cognitive performance. Certain practices and tools can help consciously harness dopamine for the purpose of focus training. One example is the strategic use of goal setting and intermittent rewards. Breaking a large task into smaller, achievable sub-goals creates a series of dopamine-releasing events as each milestone is reached. This prevents the dopamine system from fatiguing and sustains engagement across longer periods. Another is the use of time work blocks, such as the Pomodoro technique, which aligns with the brain's natural attention cycles and provides a rhythm of challenge and rest that optimizes dopaminergic activity. Additionally, learning how to delay gratification can shift the brain's focus from immediate rewards to the long-term benefits of sustained attention, promoting deeper and more enduring forms of motivation. On the pharmacological side, medications that enhance dopaminergic transmission, such as those used to treat ADHD, demonstrate how powerful dopamine's role is in attentional control. These drugs typically increase the availability of dopamine in the synaptic cleft, improving the brain's ability to maintain focus, resist distractions, and engage with tasks more fully. While these interventions are effective in clinical populations, they also underscore a broader principle that dopamine is not just a reward chemical, but a fundamental part of how the brain directs effort and energy toward meaningful goals. Visual anchoring is a technique that leverages the close relationship between the visual system and attentional networks in the brain to enhance focus and cognitive engagement. At its core, visual anchoring involves deliberately directing and maintaining gaze on a specific object or sustained attention, promoting deeper and more enduring forms of motivation. On the pharmacological side, medications that enhance dopaminergic transmission, such as those used to treat ADHD, demonstrate how powerful dopamine's role is in attentional control. These drugs typically increase the availability of dopamine in the synaptic cleft, improving the brain's ability to maintain focus, resist distractions, and engage with tasks more fully. While these interventions are effective in clinical populations, they also underscore a broader principle that dopamine is not just a reward chemical, but a fundamental part of how the brain directs effort and energy toward meaningful goals. Visual anchoring is a technique that leverages the close relationship between the visual system and attentional networks in the brain to enhance focus and cognitive engagement. At its core, visual anchoring involves deliberately directing and maintaining gaze on a specific object or moreover, visual anchoring modulates the activity of the superior colliculus, a midbrain structure involved in initiating saccades and integrating visual information with motor commands. When the superior colliculus is suppressed, such as during intentional fixation, the frequency of attentional switching is reduced. This leads to less cognitive fragmentation and greater coherence in mental processing. Functional MRI and EEG studies have shown that periods of fixed gaze are associated with increased coherence in frontal and parietal brain regions, which are involved in executive function and sustained attention. This coherence reflects a more synchronized and efficient pattern of neural firing, conducive to learning, problem-solving, and decision-making. Visual anchoring also has a direct effect on the autonomic nervous system. Specifically, fixed gaze is associated with reductions in heart rate variability and shifts in pupil diameter. sustained attention, promoting deeper and more enduring forms of motivation. On the pharmacological side, medications that enhance dopaminergic transmission, such as those used to treat ADHD, demonstrate how powerful dopamine's role is in attentional control. These drugs typically increase the availability of dopamine in the synaptic cleft, improving the brain's ability to maintain focus, resist distractions, and engage with tasks more fully. While these interventions are effective in clinical populations, they also underscore a broader principle that dopamine is not just a reward chemical, but a fundamental part of how the brain directs effort and energy toward meaningful goals. Visual anchoring is a technique that leverages the close relationship between the visual system and attentional networks in the brain to enhance focus and cognitive engagement. At its core, visual anchoring involves deliberately directing and maintaining gaze on a specific object, moreover, visual anchoring modulates the activity of the superior colliculus, a midbrain structure involved in initiating saccades and integrating visual information with motor commands. When the superior colliculus is suppressed, such as during intentional fixation, the frequency of attentional switching is reduced. This leads to less cognitive fragmentation and greater coherence in mental processing. Functional MRI and EEG studies have shown that periods of fixed gaze are associated with increased coherence in frontal and parietal brain regions, which are involved in executive function and sustained attention. This coherence reflects a more synchronized and efficient pattern of neural firing, conducive to learning, problem-solving, and decision-making. Visual anchoring also has a direct effect on the autonomic nervous system. Specifically, fixed gaze is associated with reductions in heart rate variability and shifts in pupil diameter flex, increased sympathetic tone and mental alertness. The act of narrowing the visual field and eliminating unnecessary motion cues reduces sensory load, allowing the brain to prioritize cognitive effort rather than continually assessing environmental changes. In high stimulation environments where the eyes are constantly moving and the visual field is dynamic, cognitive energy is often dispersed across multiple competing stimuli. Visual anchoring mitigates this by concentrating both visual and mental energy into a single focal point. There is also a temporal component to visual anchoring. When someone begins a cognitively demanding task, establishing visual fixation serves as a kind of neural primer. It signals to the brain that attention is now being directed towards something important, which can increase the release of neuromodulators like acetylcholine and norepinephrine. These chemicals enhance the fidelity of neural signaling by sharpening the contrast between relevant and irrelevant information. Acetylcholine in particular acts as a spotlight that boosts the signal and circuits responsible for the task at hand, while norepinephrine elevates arousal and readiness to perform. In experimental settings, individuals who use visual anchoring prior to or during focus-heavy tasks show improved performance in measures of working memory, sustained attention, and error detection. Even simple tasks like reading or solving math problems become more efficient when preceded by a few seconds of intentional gaze fixation. The technique is especially effective when paired with breath regulation, such as nasal inhalation, which further activates the locus coeruleus and enhances attentional tone. Importantly, visual anchoring is not merely about looking at something, it's about engaging the oculomotor system in a way that communicates intentionality to the brain. Passive looking does not yield the same effects. The individual must deliberately and consciously fix their gaze with the intent to engage in focused mental effort. This conscious act initiates a broader physiological state shift that favors cognitive engagement and task persistence. The body becomes still, the eyes stop scanning, and the brain enters a mode of directed processing that is more resistant to internal and external disruptions. The duration and intensity of visual anchoring can also be modulated depending on the cognitive demand. For tasks that require prolonged focus, establishing a strong visual anchor at the beginning can help set the tone, after which intermittent gaze resets may be beneficial during brief breaks. These resets allow for recalibration of attention, especially after moments of mental fatigue or distraction. In contrast, for shorter tasks, maintaining a single visual anchor throughout the entire task duration can sustain a high level of cognitive engagement without the need for resetting. Visual anchoring, therefore, provides a flexible, biologically grounded tool that enhances the brain's capacity for focused work by aligning visual behavior with attentional control systems. Deliberate distraction reduction is a foundational practice in training the brain for sustained focus and high cognitive output. In a world saturated with stimuli ranging from digital notifications to ambient noise and internal mental chatter, the ability to maintain attention on a single task requires not only effort, but also a proactive strategy to minimize or eliminate sources of interference. Distractions are not just superficial interruptions, they alter brain activity, fragment neural coherence, and diminish the quality of information processing in ways that can be biologically measured. The process of attention requires metabolic energy, and every shift in focus imposes a cost on the brain, both in terms of time and neural efficiency. The prefrontal cortex, which governs executive functions like decision-making, planning, and focus, is particularly vulnerable to interference. It does not process multiple streams of information simultaneously in the way many people assume. Instead, it switches rapidly between tasks or inputs, a phenomenon known as context switching. Each time a person is distracted and then returns to a task, the brain must reorient its network connections to reestablish cognitive flow. This reorientation consumes limited cognitive resources and often results in a delay of several minutes before regaining the same depth of focus that was present. before the interruption. Repeated interruptions, even if brief, prevent the prefrontal cortex from engaging in the kind of deep, sustained activity that leads to high-level problem solving or creativity. Distraction operates through multiple channels. External distractions include environmental stimuli like phone vibrations, email pop-ups, conversations, and background noise. Internal distractions, on the other hand, consist of intrusive thoughts, emotional reactions, and mental habits such as checking behaviors or anticipation of future events. While external distractions can often be managed through changes in environment or device settings, internal distractions require a more nuanced approach that involves retraining attention and regulating emotional responses. Deliberate distraction reduction must therefore address both of these domains. If the goal is to create a stable and productive mental environment, one of the key strategies in reducing distractions involves manipulating what neuroscientists call the sensory gating system. This system determines which sensory inputs are prioritized and which are filtered out before reaching conscious awareness. In states of high alertness or divided attention, the sensory gates become more permissive, allowing irrelevant stimuli to enter and compete for cognitive resources. Through intentional behaviors such as minimizing auditory and visual clutter, closing unused browser tabs, silencing devices, and working in a structured environment, the sensory gating threshold can be raised, which means only the most relevant inputs are allowed through. This in turn supports the brain's natural filtering mechanisms and improves attentional fidelity. Biologically, distraction is reinforced by the dopaminergic system. Novel stimuli, whether external or internal, tend to trigger small bursts of dopamine, the neuromodulator associated with salience and motivation. This is one reason why distractions are so compelling. They hijack the brain's reward system. Even trivial notifications or random thoughts are interpreted as potentially important, leading to impulsive shifts in attention. Over time, this forms a pattern of behavior that conditions the brain to seek novelty rather than remain in a stable attentional state. Deliberate distraction reduction works by depriving the brain of these unpredictable dopamine hits, which can initially lead to discomfort or restlessness. However, with repeated practice, the brain begins to reset its expectations and becomes more comfortable with sustained focus and fewer novelty spikes. Another important consideration is that distraction is context dependent. The brain forms associations between certain environments or behaviors and specific cognitive states. For example, if someone frequently checks their phone while studying, the mere presence of the phone becomes a cue that initiates distraction, even if it's not actively in use. Similarly, multitasking or working in highly stimulating environments teaches the brain to operate in a reactive rather than proactive mode. Deliberate reduction of distractions requires altering these contextual cues, reorganizing the workspace, creating defined periods for focused work, and establishing rituals that signal the beginning of a cognitively demanding task. These environmental and behavioral modifications gradually train the brain to enter a state of heightened attentional readiness when certain conditions are met. On a physiological level, the presence of distractions affects heart rate variability, cortisol levels, and brainwave patterns. Continuous partial attention, a state characterized by fragmented focus and hypervigilance to multiple inputs, is associated with increased stress markers and a predominance of high beta brainwave activity, which reflects cognitive overload. By contrast, focused attention corresponds with greater alpha and theta activity, patterns that are associated with relaxed alertness and improved memory consolidation. Reducing distractions, therefore, has a measurable impact on the brain's electrophysiological state, supporting the kind of brainwave activity that is conducive to learning, insight, and long-term retention. The practice of deliberate distraction reduction is not simply about abstaining from technology or creating a quiet room. It's about systematically shaping the mental and environmental conditions under which attention can flourish. It involves identifying and modifying the micro-habits and triggers that lead to fragmented focus and replacing them with cues and systems that promote attentional continuity. This is a dynamic process that must be repeated and refined over time as the brain adapts to new routines and expectations. The result is a cognitive environment in which the attentional systems are no longer in a constant state of vigilance and response, but instead can settle into a steady, directed state of engagement. Ultradian rhythms are biological cycles that occur within a 24-hour period, but last for less than a day, typically ranging from 90 to 120 minutes. These rhythms are integral to the functioning of our bodies and minds, influencing various physiological processes, including sleep-wake cycles, heart rate, hormone release, and cognitive performance. Understanding ultradian rhythms and their relationship to focus can profoundly impact productivity, learning, and overall mental clarity. The concept of timing cognitive work according to ultradian cycles offers a framework for optimizing attentional resources, aligning with the natural ebb and flow of mental and physical energy. The human brain operates with varying levels of alertness throughout the day, and these fluctuations follow a cyclical pattern. During periods of focused attention, there is increased activity in the prefrontal cortex, the region of the brain responsible for executive functions like decision-making, planning, and task management. This state of concentration is often sustained for roughly 90 minutes before attention begins to fade and cognitive resources deplete. After this period, the brain naturally enters a phase of reduced focus and attention, signaling a need for rest or a shift in activity. This cyclical rhythm of alertness and fatigue aligns closely with ultradian cycles, which suggests that productivity and sustained cognitive performance are maximize when tasks are scheduled in harmony with these natural rhythms. The ultradian cycle operates on a rhythmic rise and fall of mental energy. At the beginning of each cycle, the brain is in a heightened state of focus, alertness, and mental capacity. During this phase, the brain is able to engage deeply with complex tasks, solve problems, and process information at a high level of efficiency. However, as the cycle progresses, this capacity for sustained attention begins to wane and cognitive performance starts to decline. The drop-off in attention is typically gradual, but by the end of the cycle, it becomes increasingly difficult to maintain high-level focus. At this point, mental fatigue sets in, signaling the need for a period of recovery or relaxation. If individuals try to push through this natural decline in focus, cognitive performance tends to suffer. Studies have shown that working beyond the point of peak performance during an ultradian cycle leads to errors, lapses in concentration, and diminished creativity. This phenomenon explains why people often experience periods of intense productivity followed by slumps in energy and focus. By recognizing the ultradian rhythm and incorporating it into daily routines, it becomes possible to optimize working periods and minimize the negative effects of sustained focus. The timing of breaks is essential to making the most of ultradian rhythms. Taking regular breaks, particularly after 90 minutes of intense work, is vital for restoring cognitive resources and preventing burnout. Short breaks, about 10 to 15 minutes, allow the brain to reset and recharge. During this time, engaging in light physical activity, such as stretching, walking, or simply stepping away from the workspace, can be beneficial. These activities activate the parasympathetic nervous system, reducing stress and allowing the body and brain to recover. Research suggests that these restorative periods can enhance subsequent performance, allowing individuals to enter their next work cycle with renewed focus and energy. In addition to breaks, managing cognitive load is another important aspect of working with ultradian rhythms. Tasks that require high levels of concentration, such as complex problem solving or creative thinking, are best performed during the peak of the ultradian cycle when the brain is most alert and capable of deep focus. Conversely, tasks that are routine or less mentally demanding, such as answering emails or performing administrative duties, can be scheduled during the low points of the ultradian rhythm. This alignment helps conserve cognitive resources for tasks that truly require sustained attention and deep mental engagement. Diet, stress, and physical activity, for example, disruptions in sleep can skew ultradian patterns, leading to longer or shorter cycles and making it more difficult to maintain focus during peak cognitive periods. Similarly, factors like dehydration or poor nutrition can negatively impact cognitive performance, altering the natural flow of attention and increasing the likelihood of distractions. One practical way to harness the power of ultradian rhythms is through structured work periods, such as the Pomodoro technique, which involves working in intervals of 25 minutes followed by short breaks. Though not directly aligned with the 90-minute ultradian cycle, this method recognizes the importance of alternating between focused work and rest. Other strategies, such as time blocking or scheduling work according to the natural flow of energy throughout the day, also make use of these rhythms by ensuring that high-focus tasks are reserved for the brain's peak periods while low-focus tasks are left for moments of mental fatigue. By tuning into ultradian rhythms and respecting their timing, individuals can make smarter decisions about when to work, when to take breaks, and how to structure their tasks to maximize cognitive performance. This approach not only optimizes attention, but also promotes long-term mental well-being, helping individuals avoid burnout and maintain a sustainable pace of productivity. The science behind ultradian rhythms provides a clear rationale for why timing is everything when it comes to focus, and leveraging this knowledge can significantly enhance both personal and professional performance. The progressive load principle is a concept widely recognized in physical training, where the body is gradually exposed to increasing levels of stress to build strength and endurance over time. However, this principle can be equally powerful when applied to mental training. Just as muscles require gradual and increasing resistance to grow, the brain needs to be progressively challenged in order to enhance cognitive capacity, improve focus, and strengthen neural pathways. By applying the progressive load principle to mental training, individuals can foster long-term cognitive improvements, resilience, and optimal performance. The first step in understanding how the progressive load principle works for mental training is recognizing that the brain, like muscles, is malleable and adaptable. Neuroplasticity, the brain's ability to reorganize itself by forming new neural connections, is a fundamental concept in this context. The brain continually responds to the demands placed upon it, strengthening circuits that are activated and pruning those that are underused. Just as lifting a heavier weight leads to muscle growth, engaging in increasingly complex cognitive tasks leads to improvements in mental processing, problem solving, and executive function. When training the brain, the load, whether in the form of tasks, challenges, or cognitive demands, needs to be progressively increased to avoid stagnation. Starting with tasks that are too difficult or beyond one's current capabilities can lead to frustration, burnout, or mental fatigue. Conversely, tasks that are too easy will not stimulate growth or improvement. Therefore, the key to applying the progressive load principle is to begin with manageable challenges that stretch cognitive capacities and gradually increase the difficulty as the brain becomes more adept at handling the current level of load. This incremental approach to mental training works on the same principles as strength training. For instance, if someone were working on improving their focus, they could begin with short intervals of concentrated effort, such as focusing on a task for 10 minutes without distraction. Once this interval becomes easier and the brain adapts, the length of time can be gradually increased to 15 minutes, 20 minutes, and so on. Over time, the individual develops greater mental endurance, improved attention span, and the ability to stay engaged for longer periods. Just like physical training, the intensity of cognitive tasks can also be adjusted. Tasks can shift from simple rote memorization to more complex problem solving or creative thinking exercises as cognitive ability improves. The key to the progressive load principle is the concept of gradual adaptation. Cognitive overload, much like physical overload, can cause negative effects such as diminished performance or mental fatigue. If mental challenges are increased too quickly, the brain may not have the time or resources to adapt, leading to decreased efficiency or cognitive burnout. For example, a person who jumps from solving basic arithmetic problems to tackling advanced calculus without sufficient practice will experience frustration and reduced performance. Gradual increases allow the brain to make the necessary adjustments and prepare itself for the next level of complexity. Another aspect of the progressive load principle in mental training is the incorporation of rest and recovery. Just as muscles need recovery time to grow and strengthen, the brain also requires periods of rest to consolidate new learning, repair neural connections, and recover from cognitive strain. Effective mental training involves alternating between periods of focused cognitive work and restorative breaks. These breaks allow the brain to process new information, integrate it, and refresh its resources for the next training cycle. Without these recovery periods, cognitive performance will plateau or even regress. Building cognitive strength through progressive mental load also requires attention to various types of mental exercises. Mental training is not limited to a single cognitive domain, but should target a range of skills, including working memory, problem solving, creative thinking, emotional regulation, and focus. For example, an individual working on improving their working memory might begin by practicing simple exercises, such as remembering a list of 5 items and gradually work up to memorizing more complex sequences. Similarly, exercises designed to enhance focus can start with shorter durations of uninterrupted work, gradually increasing the time and complexity of the task. The notion of progressive load also extends to managing distractions. Early in a mental training program, an individual may need to focus on minimizing low-level distractions such as background noise or digital interruptions. As the individual becomes more skilled at focus, the level of distraction in the environment can be incrementally increased, challenging the brain to maintain focus in more demanding conditions. This process can also help enhance cognitive resilience as the brain learns to block out more intense distractions over time. The benefits of applying the progressive load principle extend beyond the immediate improvement of focus and cognitive focus. As cognitive capacity grows, it can lead to more effective decision-making, greater emotional regulation, and improved problem-solving abilities. When individuals are able to sustain high levels of mental effort over extended periods of time, they also build a sense of mental toughness. This resilience not only helps in academic or professional contexts, but also contributes to overall well-being as individuals become more capable of handling stress and mental fatigue. One of the practical aspects of the progressive load principle is its adaptability. Mental training programs can be tailored to an individual's specific goals and needs. Someone looking to enhance their creativity might engage in progressively challenging tasks that require divergent thinking, while another person aiming to improve their emotional control could increase the